Welcome back to Virginia this morning. Dentistry is always evolving, and digital dentistry is the wave of the future and gives patients the opportunity to actually see problem areas in their mouth. And our great friend of the show, Dr. Marcy Guthrie, is here with the details and a lot of gadgets. Wonderful to see you.
Thank you.
There are a couple of things that I went flush when you brought them in and brought them onto the table, but it's great to see you, Marcy.
Thank you.
Doctor, tell us, how is dentistry evolving? We're almost way past the 21st century now when it comes to dentistry.
Yes, dentistry has come a long way, and a lot of people that take fear into consideration and don't get into the dental door are missing out, because patient comfort has been able to increase with a lot of the new items that dentists can use these days.
Because comfort and dentistry, never really went hand in hand, at least not for me. I would always fear it, but you said things are changing.
Things are changing.
Tell us about this.
So, I brought in the old school syringe.
Yes.
Kind of gotten him nervous.
It is.
So
May I hold that? I've never
Okay.
held one of these. I've always only seen one kind of go. This is pretty scary, right? You would say.
Immediate fear and anxiety and panic attack. We deal with that daily. So.
Oh my goodness.
Now
Do you put an elephant to sleep with this thing? My word. Okay, but things are changing.
Things are changing.
For the better.
Yes.
Okay.
So we still have the set. We still have that, but we now have the wand. So we have digitally regulated anesthetic that I can do with the foot pedal right here. And we can numb the tooth, individual teeth at a time, without getting the collateral lip and tongue numbness.
You're kidding me. So you're not drooling your morning coffee after you visit the dentist?
No. You don't
How
have to
does
do
this,
that.
it just go right above the tooth? This is an individual tooth?
It does. It goes, we just numb the tooth individually.
Wow.
Single tooth anesthesia. So that is here.
So your patients must love that.
They do. I love it too, because now I can work on both sides of the mouth in the same appointment without having the whole tongue numb. Kids love it. They don't see a syringe coming at them, and they don't even know.
It looks like the old style water pick.
Yeah.
Different.
It's fun.
It's fun.
It's fun.
It must be fun being on that side to administer it, maybe not getting. Okay, we're moving on from the anesthesia to what else?
The Auraverse is also something new that we can do, that we can inject after if you don't like the anesthetic feeling, to decrease the time that it's in your body.
Interesting.
So
how long does this take to take effect?
It's a quick injection, and then it starts almost immediately. It cuts the time in half for being numb after a dental appointment.
Really?
Yes.
Okay. That's kind of nice. All right, moving on.
So then we have the sensors. There used to be the film back in the day.
Yeah.
You'd have to take the film, go into the dark room, develop it. It took a lot of time. If you didn't get to see what you wanted to see, you had to retake the film again. So time efficiency has really increased with having the DEXIS. We have the platinum sensor in our operatories. We take the image, it pops up right away on the screen, and we can communicate better what we see with the patients with regards to radiographs.
Dr. Guthrie, is it real time when
It's
you
real
see
time,
it?
right away. Right when we snap it, it comes up on the screen, and we can view it together.
So the patient and doctor.
Correct.
And so you can explain it right there what's going on.
Yes.
So you don't have necessarily that big cumbersome piece of cardboard jammed into your mouth, right?
Yes. Yep. And no time waiting for processing.
We were saying the wave of the future. Is this, would you say, is going to be just more prevalent in dentist office as time goes on?
Yes. It's
Okay.
getting there.
And how much easier does this make for you as well?
I couldn't work without it. I was a dental assistant back in the film days, but we don't have a dark room. I can't only work without it as long as we have electricity.
Okay, really?
Power
that's
goes out, we're closed.
What sort of reaction are you getting from the patients of yours, doctor?
Oh, they love it
see
because
these?
we can communicate better. We can email our X-rays back and forth, or view them and discuss them. We can compare and contrast the X-rays, manipulate the contrast to go over it better, magnify it in the operatory.
And we'll look at
so
a
that's
couple of
the
pictures
old
here
school
too.
Film. That's the same series of films you can see with the light box, and then in my office how it looks with the sensor.
And so they can really see the
And then we can
issues
blow
if
it
there
up
are.
even individually to see per screen. Really cool.
Fantastic.
Yes.
How long have you been working with this?
Since I've had my practice for 14 years.
14 years that
With
they've
digital.
had this now with digital.
Oh yeah.
And I'm sure the...
This is intro camera. I want to go.
Yeah,
So
go
this
for it.
one, this one. Okay, so this was taken before. A lot of people don't go to the dentist because they don't feel that anything, if it hurts, if it doesn't hurt, that everything is okay. So
Not
this
necessarily
was,
the case, Doc.
I could see it shadowed, and I showed a picture, and then I showed it once it was opened up, the cavity underneath. So it's a picture's worth 1,000 words, and it's
really
nice
is.
to be able to document. This was someone who hadn't had their teeth cleaned in a while, and you could see the tartar buildup, and then afterwards, and it's beautiful, and we can celebrate the successes with our patients, and they can see the improvement that they've gotten from taking the intraoral photos before and after.
Doc, it looks like a new set of choppers.
Isn't it beautiful?
Yeah, it's beautiful. It's a work of art.
So, and this is my Velscope. This is Allie, my hygienist, using the Velscope. This is April, it's World Cancer Awareness Month, and we like to use the Velscope. It emits a light. And then for abnormal tissues, it will show up black. It won't emit well, so we can use that as an adjunct to our head and neck oral cancer screenings to hopefully catch oral cancer early. 50,000 people, close to 50,000 people get oral cancer a year.
Wow,
and
that's frightening.
And this helps early detection to hopefully increase the survival rate if we can catch it soon enough.
Something as simple as this.
Yes.
That is wonderful. And not to mention, the patient looks cool with those sunglasses.
Right.
You know? Yeah. You are always chock full of great information, always on the cutting edge. Dr. Marcy Guthrie, it is always a pleasure to see you. Thanks
Thank
so
you.
much. Really.